From iHeartRadio, this is Medical Monday, presented by St. Dominic's. I'm Randy Bell, and I'm joined today by Amy Willoughby, a physical therapist at St. Dominic's. And we're going to be talking about something called dry needling. Now, Amy, just from the name, is this something similar to acupuncture? And if so, how is it similar and how is it different?
Well, dry needling is we use acupuncture needles. That's pretty much where the similarity ends. It is a therapeutic treatment. We actually insert the needles into a trigger point of the muscle belly or the soft tissues. And at our clinic, we often apply a little electric stimulation to that. It kind of creates a little mini muscle contraction, which will allow that muscle to release, which will relieve pain, improve the muscle's function, and this is actually just going straight to the source.
And this is an evidence-based form of physical therapy that's shown to be effective for some conditions. I'm kind of wondering what type of conditions respond best to dry needling.
You know, chronic pain in the low back, neck, headaches, migraines, muscle tension in the neck, which can even come from people who have, arthritis in their neck or like a car accident or something like that. Sports injuries, any, muscle strains and things like that. It's great for post-surgical pain, even scar tissue. Of course, that has to be done about 3 months after the surgery. You don't do that, immediately. Even things like fibromyalgia and, myofascial pain syndrome and chronic pain, it's beneficial.
You have a good success rate in dealing with migraines, people who've, tried different options to relieve their pain, can't get relief?
Oh, absolutely. I've been a PT for 27 years, and I tell my patients, I'm like, this is probably one of the coolest interventions I've learned in recent time. I call it a game changer. Where I work, we do a lot of hands-on manual therapy, and some people, it gets frustrating. We're like, I've tried everything. And so now that I can say, well, hey, let's try this. And sometimes it just takes 1 or 2 treatments and they're like, wow. They're like, I didn't have a headache for so many days. It's just a game changer. It really has been. And so I've had a lot of success, or people who say, well, I've had, success with manual therapy, but that, by the time I go back to my next appointment, the pain's back. I had a lady, she's like, this is the first time where the pain has stayed away from treatment to treatment and then beyond, so I've had a lot of success with it.
When you start talking about needles, though, some people are just naturally going to cringe. But how much pain really is there in something like this? And then also, how safe is it?
I'm glad you asked, because I know when I say dry needle and I get the what? So I tell my patients, like, the needle it's like a stick of maybe a flu shot. I've had patients go, I didn't even feel it. If the muscle's really tight, we push the needle further in the muscle. It feels kind of achy, so like when you get the medicine, when it goes in from the shot. But once the needle's there, you don't feel anything. And then we do apply that electricity, and that feels like literally someone's thumping you. So we don't want to cause pain. I tell the patient, if you're feeling anything shocky or painful, we need to either move the needle or turn the electric. It's not a painful experience. Safety-wise, we sterilize the field. The needles are a single-use sterile needle. We use gloves, and it is only performed by therapists that have had well over 50 hours of training. You definitely want to make sure your therapist is certified in dry needling.
So, Amy, how can people find out more about the physical therapy options at St. Dominic's, including dry needling?
You can call the clinic at 200-4920, and you can ask to speak to myself, Amy Willoughby, or just any of the therapists. And we do it all the time. We'll be glad to tell you the services we offer, and we do a lot of one-on-one treatment. And so I always tell people we're worth the drive into Jackson, but all of us have a lot of experience. Like I said, I have 27 years. We don't have anyone with under 10 years of experience. So we're very knowledgeable, and we feed off each other. If we get in a difficult situation. So we really do our best to try to do everything we can to help the patient.
That's Amy Willoughby, and I'm Randy Bell. Medical Monday is presented by St. Dominic's.